Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us on the program for today. Our guest this morning is Dr. Hooman Azmi. He's a leading expert in the treatment of Parkinson's disease, and he's joking about his newly released book, co-authored with Dr. Fiona Gupta, called Parkinson's Disease for the Hospitalist, Managing the Complex Care of a Vulnerable Population, released just last month, as a matter of fact. It was written as a reference guide for healthcare providers who tend to Parkinson's patients while they're in the hospital. Welcome to the program, Dr. Azmi.
Thank you so much.
Well, a bit of background about yourself. I did say that you're a leading expert in the treatment of PD.
Sure. I'm a neurosurgeon at North Jersey Brain and Spine Center. Our main hospital is Hackensack University Medical Center County in New Jersey. It's a large tertiary care hospital with it's busy, and so we also have a fairly significant Parkinson's patient population that comes through the doors.
Now, you've written this book, you co-authored the book called Parkinson's Disease for the Hospitalist. What motivated you to write this book?
Well, so I my expertise is in doing surgery for Parkinson's disease. And so a lot of patients that require surgery have a high dose requirement of medication there, and their timing of medication is very crucial. And when these patients come to the hospital, despite our best efforts, we can affect the timing. We can give erroneous message to these patients, and it really does affect them negatively. And there's actually multiple studies that have shown when patients with Parkinson's enter the hospital, because of errors in the timing of medicine and errors in giving contraindicated medicine, replication rates are higher than other patients. And we of course, it behooves us to take the best care of our patients. So we started to put together protocols for nurses, for pharmacy, that ensured that we at least in our hospital, we're adhering very strictly to the medication regimen of patients with Parkinson's disease, and ensuring that they don't get contraindicated medications. And over the years, these efforts coalesced into bigger protocols, and ultimately we wanted to put the book out to educate healthcare providers that happen to end up taking care of the Parkinson's patients about the disorder.
Well, give us an example of some of the tools that you're using there at Hackensack Meridian Health University Medical Center there in New Jersey to alleviate some of the complications that are not necessarily unique in the hospital, but very complicated for Parkinson's patients.
Oh, of course. So let me just, if you don't mind, tell you a little bit more about the importance of medication adherence in Parkinson's patients. Parkinson's disease is a disorder that does affect both motor symptoms, movement issues, and also non-motor symptoms, things like constipation, anxiety, depression. And when Parkinson's has been advanced, patients really are dependent on the fine-tuning of medicine. And this is really carefully by their movement disorder specialist, exact timing of the medication, exact dosing, exact brand of medication to give that patient the best quality of life. So they know their regimen, they adhere to it very quickly. Sometimes they take medicine every 2 hours, sometimes every 3 hours. I mean, it's and sometimes around the clock. So it's a very strict adherence to this medication just to allow them to move and go about their life. When patients enter the hospital for any reason, let's say for knee replacement, for abdominal pain, for God forbid a heart attack, the hospitals are not set up really to give the medicine exactly on blood pressure medicine and so forth. It can be given a little bit later, and it's such a big deal. In patients with Parkinson's disease, it really can affect negatively. There is, literature that shows even if the dose is missed over 15 minutes, that patient can develop the issues. So our biggest tool that we use is a wide-ranging education throughout the hospital. And one of the problems with Parkinson's disease, about only about 15% of patients come to the hospital with complaints of Parkinson's disease. And over 85% of people with Parkinson's come in for non-Parkinson's reasons. So the Parkinson's disease gets lost in the shuffle, and it can be anywhere in the hospital. We can't say when a Parkinson's unit and put patients. They can have knee replacement surgeries, abdominal surgeries, pneumonia, so they can be all spread through the hospital. So our mission is to educate the entire hospital staff, entire nursing staff. And we developed certain surveys, we developed webinars, and really a very, very, and we're still continuing that kind of continuous education for Parkinson's disease to raise the awareness. And then we used some of the IT technology to alert people about ensuring that they're giving the medicine on time, and also that they don't give contraindicated medications that are very commonly used in Parkinson's, in the hospitals. So these are essentially the tools that we use, and it's an ongoing process.
This book that you've co-authored is also helpful to the family members, the caregivers who are going to be at home taking care of the patient once they are released from the hospital as a result of some of these measures that you've taken.
So what we find is patients with Parkinson's and their caretakers are very, very aware of importance of medication timing. So the problem isn't really at home. The problem is when these patients end up going to the hospital. And even though the book is clearly geared at doctors, nurses, residents, and students that may end up having to care for someone that happens to have Parkinson's disease, I think the book kind of may open the eyes of caretakers. What are the internal dynamics in the hospital, and for them to be aware of it, as well as have them see in the care of the patient, make sure that they speak up and when they see errors and when they see issues, speak up and tell the care staff that something isn't right, the timing isn't right, and so forth. So in that sense, it could certainly be a benefit to caretakers and patients as well. In addition, if I could also say there is an excellent resource for patients and families that are going to go to the hospital, put out by the Parkinson's Foundation, called the Aware and Care Kit, and it really is basically a bag of important information about Parkinson's disease, and it is made so patients tell their caretakers in the hospital, give them pamphlets. This is what I have. This is medication. This is the medications that shouldn't be given to me. And also allows them to take their medicine in that bag to the hospital, so there's no confusion about what the person is on. So I highly recommend anyone with Parkinson's or caretakers with a loved one with Parkinson's disease to search that out. You can easily find it on the internet, and it's actually a free kit.
Parkinson's disease for the hospitalist, managing the complex care of a vulnerable population. I do believe that it's available at www.northjerseybrainspine.com/Hooman/Azmi.php. Thank you for joining us on the program today, Doctor.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.